Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. Yes, for paid online consultation, you can definitely WhatsApp me on 9226810 My dear friends, the number is always there in the description. This is the series regarding the clinical examination of the patient in general medical practice. And today I am going to present you a case of the patient of infective hepatitis, of course, jaundice. So, one day, 24-year-old male patient came to me and he explained, Doctor, I have the fever. Oh, and severe anorexia since last 2-3 days. Oh, I don't feel like looking at the food. Such a nauseating feeling is there. And I don't know, but I am feeling very, very weak. Then I started thinking and immediately one thought came in my mind. Such a severe anorexia? Oh, such a severe anorexia is possible only in infective hepatitis or the jaundice. So naturally, I started to ask the question or history taking. My first question was, see, your urine is a dark yellow or red? Yes, doctor, it is right, it is right. Oh, then it is again supporting my thinking of jaundice. Do you have any pain in the right upper part of your abdomen? Yes, doctor, I am having some pain. Okay, did you get a lot of itching anywhere in the body? Yeah, doctor, I get the mild itching. This mild itching, pain in the right upper abdominal region, dark color urine, all are supporting my provisional diagnosis of infective hepatitis or the jaundice. Naturally, I start inspecting the first eyes. This is very important in the case of jaundice. So I start to check the white part of the eye, that is called as the sclera. So I start to examine the sclera and I ask the patient, please, will you please come outside to my clinic? Let us see your eyes in direct sunlight. And I checked for icterus. So I took the patient to the window nearby in my clinic and asked the patient to look down. Then I lifted the upper eyelid and inspect the upper sclera for icterus. But, I must explain you that icterus can be present or can be clear 2 to 3 days after anorexia and fever. So if some patient is not having the icterus but having the anorexia, having the fever, then I will have to ask the patient to keep a watch on the urine color and also the eyes. If they are yellow, immediately inform to me. Okay, then I ask the patient, will you please come on the examination table? And then I ask the patient to lie down on my examination table. I ask the patient to flex the legs. That means fold the legs in the knee joint. This is very important while examining abdomen because that makes the abdominal muscle relaxed. My dear friends, when you want to examine any patient for any disease, always it is better to stand on the right side of the patient. Remember this thing. You should always on the right side of the patient. Okay. So the patient has lied down and I am thinking jaundice, infective hepatitis. So I am more concerned with palpation of liver. So naturally, as usual, as the standard method, I start palpating the liver. Oh, the liver is soft. But when I press at the liver border, the patient grumbles, ah, doctor. So doctor, this is called as tenderness of the liver. And my dear friends, soft, tender liver is very specific in infective hepatitis or the jaundice. Even tenderness under the costal margin can also suggest to you the infective hepatitis or jaundice. Okay, so most of the things are very clear, and this is probably the case of infective hepatitis or jaundice. Then of course, but I want to rule out the other possibilities. I ask the patient whether you have traveled in last 8-15 days, whether you have taken the outside water or the road street food. That is very important because infective hepatitis A is because of the contaminated water. Try to understand. We must find out the cause. Where is the cause? Then I also ask whether where he is living, are there any other his friends or relatives had that particular problem of the jaundice? Fortunately said, no, doctor, nobody is there. Because this infective hepatitis can land like an endemic or epidemic. This is also very important. But in jaundice or infective hepatitis, I have to rule out the other some differential diagnosis or conditions. So I continued my questions. I continued my history taking. I asked the patient, see my dear friend, have you taken any injections or blood transfusions in last few days? He said, no, doctor, I don't have any blood transfusions, BT. I don't have any injections. Then I clearly asked him whether you have visited any outside other than your family relation, because I wanted to check the exposure of STD, sexually transmitted disease. So I asked him whether he has visited any sex worker, because I want to rule out the hepatitis B disease. Try to understand, hepatitis A, I have already diagnosed, provisional diagnosis, but I want to rule out the infective hepatitis B. Then I also asked him whether he has taken immunization or the vaccine against hepatitis B. Oh, no, doctor, I don't know what is that vaccine. I have not taken, because that is a protective or the preventive measure. Next, another things I want to rule out. I asked him whether he has any spasmodic colicky pain in the right upper abdomen, because that may be something related with the gallstones or the bile stones. Cholelithiasis, that's right. But he said, no, doctor, I don't have any other part anywhere pain. Okay. Then I asked him whether you are taking any medicines or the drugs at this moment for any other disease. No, doctor, I don't think I am on any medicine because I don't have any other disease. What was in my mind? I was thinking about any hepatotoxic medicines that patient is taking. For example, anti-tubercular medicine, AKT, anti-COX treatment contains rifampicin, and rifampicin is hepatotoxic. So I want to check it out. Next, I will go further and I will see whether this particular jaundice is deep, very, very dark colored of the sclera, and he has a high fever. And also the patient, of course, this particular patient is okay, is normal. That means it's not complicated case. But I must keep in my mind, if another patient with the jaundice is deep, and the patient is drowsy or patient is irritable, then there is a change in the sleeping pattern. Patient is sleeping in the daytime and not sleeping in the night time. This is reversal of the sleep rhythm. Then I can check the flapping tremors. Why I am doing this thing? Because in the case of jaundice, if the bilirubin level is very high, if the patient is drowsy or irritable, if the patient is having flapping tremors, the patient may be impending hepatic coma. Oh my God. Because if the patient is tending, going towards the hepatic coma, it's a danger, danger, and danger. So if any doctor is suspecting hepatic coma, he must admit the patient immediately. Because if the hepatic coma confirmed exists, it is moreover irreversible. The patient may die. Also, if any jaundice case, of course not this patient, it is near over, my diagnosis is okay with the patient. But if any patient having the jaundice recurrent or having a long duration, more than 1 month, then I must suspect, in spite of hepatitis A, I must think of hepatitis B, which is called as a serum jaundice, which can come. Hepatitis B causes are not contaminated water. The causes are, moreover, you can check the blood transfusion, any injections, then STD type or sexual exposure. These are the causes of hepatitis B. Okay, nothing to be worried. Relax, relax. This patient, today we are discussing infective hepatitis A. What will be my strategy, plan, action plan? First important thing, this is viral infection. So automatic recovery is possible, natural recovery. Nothing special has to be done. But complete bed rest is very essential, minimum for 3 weeks. Remember my words. If you have jaundice, infective hepatitis A, complete rest at your home. Not going to the school, not going to the college, not going to the business, not going to the office. Then liver is producing bile, and bile is essential for fat digestion. So there is no bile now, no proper secretion of bile. So the patient should not take the fatty food or the high calorie food or the fried substances. If the patient is little bit weak because he is not eager to eat, anorexia, loss of appetite, then for the weakness, symptomatically, some intravenous glucose can be given or oral glucose water can be given. Then some medicines in allopathy are there, like for example, liver support medicines, phospholipids, silymarin tablet, lornit tablet, trichodol. All these are liver supportive medicines. Then doctor must take care that avoid the hepatotoxic drugs, including paracetamol. Paracetamol is also, try to understand, hepatotoxic, so be careful. And avoid the sedatives also. And simultaneously, clinical diagnosis is a provisional diagnosis. So what I should investigate? The simple thing I can do is urine routine examination. And in urine routine examination, I will get bile salts and bile pigments present. Then also to see the level of the jaundice, severity of the jaundice, I can check serum bilirubin liver test, liver function test. Then I can do one blood test, HBsAg. HBsAg, Australia antigen. Australia antigen will be positive in hepatitis B. In liver function test, the enzyme levels will be increased like SGOT, increase, SGPT, increase. And last but not least, I will also check liver and gallbladder by doing sonography or USG abdomen. My dear friends, before concluding this video, please wait, because I am giving you very, very interesting information about Ayurvedic medicines. I personally has made a very good research with the modern parameters, and we have found out with the Ayurvedic medicine, with the control group, we can improve the patient subjectively and objectively. It was done already, the research is completed. One group with the Ayurvedic medicines, one group with the modern standard of treatment. And Ayurvedic people, Ayurvedic patients, Ayurvedic group, where we have given the Ayurvedic medicines, they recover within the 1 week. Their appetite improves within the 1 week and their serum bilirubin starts going down within 1 week. It was not there with the modern medicine. And what we have given, please see that we had given Arogyavardhini tablet, 3 tablets morning, 3 tablets afternoon, 3 tablets in the evening with Kumari Asava number 1. 4 teaspoons with equal amount of water, 3 times in a day with Arogyavardhini. So my dear friends, Arogyavardhini and Kumari Asava are the best medicines for the infective hepatitis A, that is the jaundice. Thank you very much. My dear friends, as you know very well that if you want the paid consultation, you can WhatsApp me on 9226810630. But please share this video, like this video, and don't forget to subscribe my YouTube channel to boost my energy. I wish you all the best. Take care and see you in the next video. Thank you very much.